Overview of Healthcare System in Korea. Hello, this is Taejung Kim, Senior Research Fellow of Korea Institute for Health and Social Affairs. Today, I'd like to explain the healthcare system in Korea. This lecture is designed to help you understand the healthcare system in Korea, related policies and challenges. Healthcare policies largely consists of healthcare delivery system, medical resources, and financing. The purpose of this lecture is to provide the status of Korea regarding each component and explain the causes of the problems in the healthcare system. Specifically, this lecture provides an overview of healthcare system in Korea, including the advantages, characteristics of paradigm on the healthcare system, and it is designed to help you better understand the healthcare system in Korea and compare it with the ones of other countries. This lecture consists of healthcare system, status of healthcare, challenges facing the healthcare system, response to the challenges, and implications. The lecture aims to help the lecture participants understand the history of the healthcare system in Korea and come up with implications on their countries, understand challenges facing the healthcare system in Korea and how to respond to the problems, and understand the components of healthcare system, including healthcare delivery system, medical resources, and financing, and help the participants explain the healthcare system in their countries with such components. The healthcare delivery system refers to the one that systemizes the medical service delivery process and the details of services provided to effectively use the limited healthcare resources in order to help people stay healthy. Since the National Medical Act was enacted in 1951, the country has introduced and implemented a series of healthcare schemes, including the Insurance Society for Employees in 1977 and National Health Insurance in 1989. Separation of dispensing and prescribing was made in 2000s, and in 2003, the country integrated the financial reserve of health insurance and adopted the long-term care for the elderly in 2008. I will explain you about the Social Security system in Korea. According to the Framework Act on Social Security, the term Social Security means social insurance, public assistance, and social welfare service that guarantee income and services necessary to protect all citizens from social harms, such as childbirth, nurturing children, unemployment, aging, disability, illness, poverty, and death, and to improve their quality of life. To be specific, social insurance refers to the system that guarantees public health and income by responding to social harms through insurance programs, and all citizens are obliged to subscribe such schemes. Social insurance consists of income security and healthcare security, and types of each guarantee includes industrial accident compensation insurance, national pension scheme, employment insurance for income guarantee, and national health insurance, industrial accident compensation insurance for healthcare security. Through public assistance, a state guarantees the minimum standard of living of its citizens and supports their self-reliance. National Basic Livelihood Security Program and medical care assistance are included in the public aid. Lastly, social welfare service relates to activities to guarantee a life worthy of human dignity in terms of welfare, education, and housing, and the system supports citizens to improve their quality of living through counseling, rehabilitation, and aid to social engagement. National Health Insurance is a social security system allowing citizens to receive the medical services they need. Citizens regularly pay the premiums, and NHIS, or the insurer, manages and operates the collected premium and provides the insurance benefits to share the mutual risk. Citizens are obligated to subscribe to the insurance and pay the premium, although the premium amount is determined according to the ability of citizens for payment, but the insurance benefits are equally provided in accordance with the relevant act. National health insurance was first adopted in 1977 as a mandatory system. All workplaces hiring more than 500 employees should subscribe to the scheme, and which was the beginning of the Insurance Society for Employees. The plan was expanded to include working sites with more than 5 workers in 1988, and all employees there were covered by the Employee Health Insurance Program. As for the local medical insurance, or the Insurance Society for the Self-Employed, citizens living in agricultural and fishery areas became eligible to purchase the scheme in 1988. and the scope of program has expanded to include the self-employed in cities in 1989, so that all citizens can subscribe to the National Health Insurance Program. In 1998, the Insurance Society for Government and Private School Employees was integrated into the local medical insurance program for the first time. Later, the local medical insurance program, Insurance Society for Government and Private School Employees, and Insurance Society for Employees are fully integrated in 2000 and continue to be operated as of now. Health Security System, health insurance, is designed for a state or society to provide healthcare services required to protect the right to health of its citizens through a system. There are largely two types of health insurance, including NHI and NHS, and the healthcare system of Korea belongs to NHI. As for National Health Insurance, NHI, citizens are primarily responsible for their medical expenses, and the fund is financed with premiums and national subsidy in part. And the payment of medical service fees is made through fee-for-service and global budget. NHI provides a relatively high quality of medical services, have a positive impact on the development of advanced medical technologies. However, it is difficult to apply a unified premium to the members of a society whose income levels are different. Medical Service Fee Payment System refers to the method to pay the service providers in return for their services, and it plays a significant role to determine the quality of medical service, medical expense, medical service fee review, and management method. Korea largely applies fee-for-service, under which the service charge is allocated per service, and partially uses DRG, diagnosis-related groups, for some types of diseases. Also, the country runs a new type of DRG, combining both fee-for-service and DRG as a pilot program. The table in the slide indicates the number of medical care services received, medical service fees, and insurance benefits continue to increase. It can be interpreted as the characteristics of fee-for-service scheme. If such trend continues, however, it may threaten the sustainability of the national health insurance finance. Now let's take a look at the medical institutions. Clinical privileges are set across the country based on administrative regions and living zones, and medical institutions are classified as primary, secondary, and tertiary hospitals to distribute and allocate their roles accordingly. Currently, hospitals are classified as primary medical institutions, clinics, secondary medical institutions, hospitals, and tertiary medical institutions, general hospitals. But patients can choose hospitals they want to visit freely if they have medical treatment requests between hospitals. Let's move on to the status of medical institutions in Korea. The number of hospital beds per 1,000 population in Korea is 12, and which is highly above the OECD average of 4.5 beds. It is true that the number of hospital beds have gradually increased, but it should be considered as the result of increasing competition between medical institutions. As for the share of beds in private hospitals, about 90% of beds are found in private hospitals, compared to 5% in the UK and 35% in the US. It means that there is a huge possibility that healthcare problems may occur, such as gaps between regions regarding access to medical services and insufficient medical services. We can easily assume the share of private hospitals in Korea by comparing it with that of Germany and Japan applying NHI, the same health insurance method of Korea. As for the medical equipment owned by medical institutions, the number of equipment, including CT, MRI, PET in Korea per 1 million population is higher than that of OECD average. For instance, the number of CTs in Korea is 1.5 times higher than that of the OECD average, and MRI and PET is also higher by 1.8 times and 2.2 times, respectively. But such oversupply of medical equipment in quantity may lead to the excessive use of medical services. Next, I will explain you about the status of medical personnel, including doctors and nurses in particular with regard to the medical resources. As of 2017, the number of doctors in Korea was about 100,000 or 2.29 doctors per 1,000 population, and which is about 2/3 of the OECD average with 3.4 persons. The number of medical school graduates per 100,000 population was 7.9 in 2016, and it was two-thirds of the OECD average with 12.1. According to the 2017 research on the mid to long-term supply of medical personnel, it is expected that demands for medical services will increase and the problem of medical personnel shortage will be intensified. The government recognized the need to manage the supply of medical personnel, as it estimated that the country would require 7,646 more doctors in 2030. Hence, the government continues to provide the mid to long-term supply management measures, including reemployment of idling personnel. The table on the right side of the slide also indicates that the number of doctors in Korea is insufficient compared to that of the OECD average. As for nurses, the number of registered nurses was 19.6 per 1,000 population, fostering more nurses than the OECD average with 13.6. But the number of clinical nurses working at medical institutions in practice was only 6.8 per 1,000 population, and was far short from that of the OECD average with 8.8, which led to the mismatch between supply and demand. Also, it is reported that a lack of nurses in local and mid-sized hospitals is severe, as most of them were working in the metropolitan areas and large hospitals. It was mainly caused by changing jobs or retirement due to the poor working environment and difficulties in reemployment after career disruption. This slide is about the financing method of health insurance, as I briefly mentioned earlier. Health insurance system in Korea has a single insurance provider. NHIS collects the insurance premiums and pays medical care institutions for the services they provide. And Health Insurance Review and Assessment Service, HIRA, reviews and assesses the expenses claimed. The table above indicates how the national health insurance in Korea is financed. The health insurance reserve is financed with insurance premiums, 86.4%, subsidies, 13.2%, and some of taxation measures. As for contributions, the insured is classified and charged separately with local health insurance subscribers and employee health insurance subscribers. And the government subsidy consists of General Accounting and National Health Promotion Fund. For the money according to the General Accounting, 14% of the estimated revenue of insurance contributions for the year is allocated, and 6% of the estimated revenue of insurance contributions for the year is allocated for National Health Promotion Fund. With regard to the distribution of covered population as of 2017, employee insured and self-employed accounted for 70.4% and 26.8% for each, and the medical aid subscribers took the share of 2.8% in total. The contribution rate of employee insured continues to increase each year from 6.12% of their income in 2017 to 6.24% and 6.46% in 2018 and 2019, respectively. The employer or company pays 50% of contributions, and the insured employee pays the remaining half. The value per point for self-employed insured or local medical insurance subscribers has risen from 179.6 won to 183.3 won and 189.7 won in 2018 and 2019 for each. The value per point is calculated according to their income, property, displacement of vehicle. Go on to find out about the health insurance reserve and healthcare expenditure of Korea. First of all, the average annual growth rate of medical expense per person continues to increase. There are various reasons to explain such increase. Expansion of social guarantee both in quantity and quality, increasing income level, high demands for medical service, rapid technological change, increasing population with chronic diseases, and population aging, to name a few. Also, low birth rate, transfer of duty of nursing care to the society are considered as factors that may lead the increase of healthcare spending in the future. If such upward trend continues, it may deplete the health insurance reserve. Hence, we need to provide countermeasures urgently. There are various challenges that the healthcare system in Korea face. I will explain some of them that should be tackled most urgently. First, population aging. According to the Special Population Estimation for 2017 through 2067, it is estimated that the number of elderly people aged over 65 in Korea will be 10.51 million in 2025. Against this backdrop, we need to be aware that the long-term care of elderly people is not only limited to households, but it should be considered as an issue to be tackled by the government. Second challenge is the coverage of national health insurance. As of 2018, the coverage rate of national health insurance is 63.8%, and patients account for the remaining 36.2% of the total medical expense. With regard to the 36.2%, the insured pay 19.6%, and the rest of the expense, 16.6%, is covered by non-insured medical service fees. As for the amount that the insured have to pay, the insured have to pay a 20% of total medical charges for inpatient medical services, 20 to 50% of the total for outpatient medical services, and 30% of the drug cost for each. We have made an effort to constantly increase the coverage of national health insurance since 2005, and the coverage on severe diseases has improved significantly. Still, the overall coverage is far below that of OECD countries. The government announced its healthcare initiative called Moon Care on August 9th of 2017 and has implemented a series of policies, including integration of all non-insured medical service fees into national health insurance to block the balloon effect of non-insured medical services fees, repeal of additional specialist charge, increasing the number of hospital wards, providing both nursing and care services, and increasing financial support for medical expenses upon disaster. Moon Care can be considered to reflect the elements including increasing burdens on households, increasing public expectations, and uncertain risk factors. Go on to the paradigm shift in healthcare. According to the 2012 OECD review on the healthcare system in Korea, it said the key policy priority for improving the quality of care in Korea should be the development of a strong primary care sector. We were able to confirm that the time is approaching for us to shift the focus of healthcare system from curative-oriented service to prevention-oriented one. We look over the advantages of healthcare system in Korea, and they can be summarized as follows. The national health insurance coverage for citizens has universally increased in a relatively short period of time. Patients can experience quality medical services effectively compared to the cost they paid, and the fact that healthcare expenditure is relatively low compared to healthcare spending per person and GDP can be said as advantages, and benchmarking the healthcare system in Korea can be meaningful for countries that have not reorganized their healthcare systems yet. As COVID-19 sweeps through the globe, more countries are required to review and transform their healthcare systems. The healthcare system in Korea is highly valued by countries across the world as it successfully controlled the spread of disease promptly, although the country witnessed mass outbreaks in the early stage. The reason behind the success of K-quarantine may have been related to the experience of MERS, another type of coronavirus, in 2015, as the country has developed various countermeasures in preparation for infectious disease outbreak since then. However, a strong healthcare system allowing the health authorities to respond to the public health crisis can be said as a more fundamental reason. The main characteristics of healthcare system in Korea are universal health coverage, equitable access for the healthcare system, cost-effectiveness in healthcare technology, and countries may consider to build a single national health insurance system like the one in Korea as an approach to achieve the goal of universal health coverage. Thanks for listening.